Hi, Mark.
Hello.
Hi, Mark.
Hey.
All right. Let's see. Welcome, everyone. Just going to give folks another minute here. I do a little quick scan to see who of our steering committee members are on. Excellent. Okay, looks like we're close to a quorum here. So we'll go ahead and get started. We have a busy agenda today. So nice to see everyone. Welcome to the Behavioral Health System Redesign Steering Committee meeting. So this is our steering committee meeting. This is the subset of CRIS committee members that are participating on the steering committee. And then next week will be our full CRIS committee meeting. So before we get started with the bulk of our agenda today, I want to do a quick tech review to remind everybody of how our technology works and our expectations for using it. I know many of you are more familiar than you ever wanted to be with Zoom, but it's probably worth just doing a quick overview. So Nicola, if you wouldn't mind sharing the screen with the slides, that would be excellent. All right, so let's go to slide number 2. And Nicola, if you wouldn't mind putting it in presentation mode so we can see the full slide, please.
Yes.
While she's doing that, I will remind folks, I am Jamie Strauss-Clark. I'm your facilitator. I forgot to say that at the beginning. So she, her pronouns. Okay, there we go. Perfect. So if you can go down to the next slide, Nicola. I have 2 slides, one for our steering committee members and one for our guests and observers today. So Nicola, jump one more slide ahead, please.
1 second.
Oh, sorry. All right, perfect. So this is an example of what your screen and tools will look like. As a reminder for steering committee members, if you could please have your cameras on, if of course you have the internet bandwidth to do it, and your mic's muted unless you're speaking, that would be great. The cameras on really helps me facilitate and be able to connect directly with you, even though we can't be in a room together. So Nicola, just hit that down arrow once and then I'll remind people where the mute, there we go. So that's your mute button. And if you hit again, your video button is where you see the red arrow. Hit another time, please, Nicola. All right, we're going to use the raise your hand function as we always do. This will keep us from talking over each other. So to raise your hand, just click on that reactions button and it'll pop up a window and you'll see raise hand. As I say, always, if all else fails, just wave your hands. There's only a few of you on the screen today, so I should be able to catch you. And then click again, Nicola, please. For chat, you can use the chat function today if you like. I am going to be checking in on the chat function, but not being able to monitor always in real time. So please be aware that I might not catch your chats right when you send them, but we are going to have a recording of the chats and we'll make sure it's part of the record from the meeting. Nicola, if you could click again. And we actually turned off closed captioning today, folks. I know we've used that before, but we have our ASL interpreters today, which I'll talk about in just a moment. It turns out the closed captioning we think might have been causing some of the destabilization of our system. So we turned that off today and relying on our ASL interpreters. You'll see the red arrow at the speaker view. This allows you, if you click on that and then click gallery, then you can see all of your steering committee members at once. And that is a view that you might prefer for this meeting. All right, let's switch to the next screen for our Zoom etiquette for our guests. And welcome guests. Thank you as ever for being here and for your commitment to being with us. Oh, is that the next slide?
Not yet. There.
Okay. Oh, actually, if you could back up. All right, this slide says steering committee members, but I think this one is actually meant for our guests. So it's a little bit different. The big difference is I'm going to ask our guests to please leave your video cameras off throughout the business part of the meeting, and your mics muted. And the reason I do that is there are 63 people on the call today. And if all of you have your cameras on, I'm going to have a harder time seeing and working with our steering committee members. That said, we do have a public comment period at the end of the meeting. If you are coming up to do public comment, that is a great time to turn your camera on, and I'll walk you through the public comment approach shortly. So again, if you are not on the steering committee, if you are not one of the 7 steering committee members, please have your cameras off and your mics muted. Nicola, if you could just click through again. Should pop up some arrows. Oh, that's okay. That's all right. I think everyone knows where everything is. So again, our guests, if you could keep your mics muted and your cameras off, that would be great. I also want to recognize that we have our ASL interpreters with us today for those of you who need some support for understanding the meeting if you have hearing impairment. Today we have Abel Constantino, who is currently interpreting, and next up will be Lori Reinhardt. They will switch off every 15 minutes, but they've both been spotlighted, so you should be able to see them on your screen for the whole meeting. All right, let's go into our welcome, introductions, and review. I want to start off with walking you through our objectives today, and then we have a few activities or a few other things that we're going to do. So today, first, we want to continue to build and sustain collaborative relationships with each other and provide our newest steering committee member, Bipasha Mukherjee, with a warm welcome. So welcome, Bipasha, and you can see her waving at you on the screen there. We're going to review the updated agenda for the November 16th CRIS committee meeting with a focus on how the project team has addressed the feedback we heard from you at our last meeting together, which I think was October 12th, and confirm any final input. We're going to give an update on progress on forming subcommittees, including any potential gaps we're seeing in representation and next steps. We're also going to update you on our plan for the end of year progress report, comprehensive assessment, et cetera, and next steps on delivering preliminary funding recommendations for the 988 line and gather your feedback. And then finally, we're going to hear public comment at the end of the meeting. Before we dive into that, I do want to pause and ask Michelle Roberts with Department of Health to offer our land acknowledgement today. So Nicola, if you could stop the share for just a moment, that would be great.
Well, good afternoon, everybody. I am Michelle Roberts with the Washington State Department of Health. I'm joining the meeting today from Olympia, the traditional home lands of the tribes we know today as Coast Salish, specifically the Nisqually and Squaxin Island peoples. Olympia and the Puget Sound region are covered by the Treaty of Medicine Creek, signed under duress in 1854. The employees of the state of Washington participating today are guided by the Centennial Accord and Chapter 43.376 RCW, respecting and affirming tribal sovereignty and working with our tribal governments throughout the state in government-to-government partnership. We honor and thank their ancestors and leaders who have always been and are the rightful stewards of these lands and waters. We also respectfully acknowledge all of the tribal communities and peoples throughout the state of Washington and give gratitude for their critical roles in behavioral health and suicide prevention efforts. The partnerships, knowledge, and guidance offered to us as state employees enables us to serve tribal communities to the best of our ability in a way that recognizes and learns from the impacts of intergenerational trauma and damage caused by past and current inequities and injustices. We strive to support tribal nations to the best of our ability, and we recognize our role as visitors in their communities. We honor with gratitude the inhabitants of these lands.
Thank you, Michelle. Appreciate that. I'm going to ask each of our steering committee members to introduce themselves so that our guests know who they are hearing from today. But before we do that, I would like to ask Senator Dingra to extend a special welcome and introduction to our newest steering committee member. Senator Dingra.
Thank you so much. I am so very excited that we have our new steering committee member, Bipasha. What I am extremely excited about is the fact that she brings that pure voice to our group, which I think is so needed, and to the entire process. Along with having lived experience, she is someone who has worked with our youth. She has worked in our crisis system. She is familiar with our criminal system. The fact that she has family members that have been impacted, has worked both in the community as well, answers the crisis line at the crisis clinic. And I think all of her expertise in all of these areas really brings a critical and crucial voice that we need as we do our work. And in addition to that, the fact that she just has such a calm demeanor, I think is going to serve us very well. So welcome, Bipasha. We're very excited to have you join the steering committee.
Thank you, Bipasha. Thank you, Senator Dingra, for a lovely welcome and introduction. And now I'm going to ask each of our steering committee members to introduce themselves, and then we'll introduce a couple of our staff members. So I'm going to call on you in the order I see you on my screen. And if you could just, again, remind our guests of your name, organization, or what you are representing. And if you have preferred pronouns you'd like to share, please do that as well. And the first person I see on my screen is Mark Snowden.
I'm Mark Snowden. I'm a professor in the Department of Psychiatry and Chief of Service here at Harborview Medical Center, and I use he and him pronouns.
Thank you, Mark. And Bipasha, I know you just got a introduction there, but I would love if you don't mind just saying hello to everyone yourself. You can go ahead.
Hello and namaste, and thank you for the warm welcome, Anka. And I am honestly humbled to be here, and also honestly terrified because this comes with big responsibility, and I hope to bring the best of me to this journey. So thank you for having me.
Thank you, Bipasha. And then I see Carrie.
Hi, Carrie Waterland. I knew I was going to have to follow Bipasha after she started speaking and saying everything so eloquently. I was like, oh, great, I'm going to have to go after her. So listen, I too, every time I'm excited and sometimes terrified because this is such great work. So I'm the division director of the Division of Behavioral Health and Recovery at Healthcare Authority. I'm really excited to be here, and I use she, her pronouns. Thank you.
It seems that maybe we should try to maintain that sense of excitement and a healthy dose of fear as we go throughout this work together. Representative Orwell.
Hi, good afternoon. Tina Orwell. I have the honor of representing the 33rd Legislative District in South King County. I'm a social worker and mental health professional. Incredibly excited to be here, and my pronouns are she and her.
Thank you. And then Michelle Roberts.
Well, good afternoon again, and welcome, Bipasha. We're so glad you're here joining us. So Michelle Roberts, I use she and her pronouns. I am the acting assistant secretary for our prevention and community health division at the Department of Health. And that is where our suicide prevention and support for the state suicide prevention hotlines. That's where that work sits at the department. So honored to be here. And yes, healthy dose of honor and excitement, and a little bit of awe about the work to come as we really do this work together. I was just telling Betsy earlier that the need could never be more acute than the behavioral health impacts of COVID. So really happy to be here to help guide the system as we move forward.
Well put. Senator Dingra.
Good afternoon, Manka Dingra, State Senator from the 45th Legislative District, which is the King County parts of the city of Woodinville, parts of the city of Redmond, Kirkland, Sammamish, and Duval. I'm the Deputy Majority Leader of the Washington State Senate, and I chair the Behavioral Health Subcommittee, and I'm Vice Chair of Law and Justice. So a lot of intersections with this work. I did want to say that we have lost electricity in our house, so I am at this meeting with my phone. So I just apologize if there are any interruptions as we move this forward, but I should be able to last for the entire meeting. So thank you.
Thank you for being resourceful there. And actually, we were just talking about that before the meeting, that all of us are here in at least the Seattle area, and I imagine in other parts of the region are a little bit at risk of some short-term but high impact winds coming through and potentially knocking out power. So just letting everyone know in case one of us drops off, we've got others ready to back each other up with the facilitation. But there may need to be a little grace extended today as ever with our technology. And last but not least, Amber leaders.
Hi, Amber leaders. My pronouns are she, her. I am also participating on my phone today in a remote location, so I will likely keep my video off for most of the meeting, but I will be here. I am a senior policy advisor to Governor Inslee, and I cover behavioral health, aging, and disability.
Wonderful. Thank you, Amber. And so I'm just going to walk you briefly through our agenda, and then we'll do our little ice melter. And as ever, we'd like to do a little audience participation on that. So I'll throw that question out to you shortly, but first let me just take you through our agenda. All right, so we've done the technology review. We're almost done with our welcome and introductions. First portion of our meeting, we're going to finalize our plans for next week's CRIS committee meeting. And then at 3:45, Betsy's going to provide you with an update on where we are with subcommittees, and there'll be some opportunity if you have questions about that. At 4:15, we want to talk with you about plans for the report and the comprehensive assessment coming up and get your feedback. And then we'll do action items and next steps at 4:35 with our expectation that we'll start public comment at 4:38. I'll walk our folks that have signed up to do public comment through the process, and then we'll adjourn at 5 o'clock today. Nicola, I think what might be good, if you don't mind just advancing through the slides really quick to the end that shows our list of people making public comment. I might just quickly show everyone. I apologize. Spoiler alert, everyone, close your eyes. All right, so this is our list of folks who've signed up to make public comment in the order they signed up. So this is these are the folks I'm going to be calling on at the end in this order. Just wanted to show that so everyone knows where they are on the list, and that should set your expectations. Since there's only 14 and we have 20 minutes for public comment, I don't think we're going to have any problem getting through our whole list of folks who signed up today, and we can keep the comments at 2 minutes today instead of having to shorten it to 90 seconds. So thank you, Nicola. Sorry for throwing through a loop. You can stop the share, and I will throw out my super hard-hitting ice melter question, which is for our steering committee members to answer out loud. But our guests, if you have a response to this question, please do pop it in the chat. I'm very interested to hear your thoughts as well. So today, if you could take a moment and then tell us what movie or song best captures your mood today and why. So I will start by saying today Trainwreck is my movie. I'm not sure it requires any explanation other than it's just been one of those days where I do feel a little bit train wrecky. So that's mine. I shared that with you now just to buy you a little bit of time to think about it. Does anyone feel ready to share their, Representative Orwell, we can always count on you to jump in. Thank you so much. What is your movie or song today?
It's so funny you raised that question, because I was feeling kind of a Groundhog Day, because I kept having a meeting and we'd had like the same dialogue 2 weeks earlier. So I've had a Groundhog's Day.
I know that feeling very well, and yes, we'll try to switch that here and throw some totally new topics at you. And again, guests in our audience, if you come up with any that you want to share in the chat, please do throw that in. Senator Dingra, what's yours today?
You know, what came to my mind right when you asked that was Singing in the Rain.
Oh.
And, I do feel optimistic about this work and the fact that we're chugging along and the weather speaks for itself.
Yes, that's actually a lovely thought. And that movie does make rain quite joyful. So thanks for putting that out there. I actually moved to the Pacific Northwest for the rain, so I appreciate days like this. Mark, what's yours?
Windmills of Your Mind. I discovered a Sting album of jazz songs over the weekend, and that one caught my attention. And my office here at Harborview is on the 5th floor, and there's a tree out of my office that is blowing so violently that I feel like a windmill, literally almost, watching it blow back and forth, wondering if my building's going to stay up.
That's a good one. I like it. I like the weather-related ones. This is very good. Other steering committee members? Carrie.
Yeah, hey, so I came into our office today, which is not normal, right? I usually am calling from Tacoma. And so Michelle, thank you for the land acknowledgement around the Olympia area. I really appreciate that. So into the office today and the usual suspects actually came into my mind. So that is my movie.
All right, excellent. Amber, how about you?
Yeah, I'm gonna go with Into the Unknown. So anyone who is a parent of small children will know that is from the movie Frozen 2, which is currently playing in the background over here for my little one to keep her distracted. And since I'm participating on my phone, which I've never really done before for a meeting like this, we'll see how this goes.
I like it. That's very relevant in so many ways. Let's see, did we get everyone? Bipasha, how about you? Do you have one?
Sorry. Oh, Rihanna, Shine Bright Like a Diamond.
Oh,
Listening to a
nice.
lot of Rihanna over the weekend, and it's dark, and I hope we can all shine, all of us, the whole state, and bring our best shiny selves to this process.
I love that. That's a good word. That's a good note to end on. Did I miss anybody? I hope I got everybody. Oh, Michelle, I'm sorry.
No, it's just fine. Well, I was thinking, though my mind always goes blank, so I had to Google songs about change because I was in the office for a while today too, but because one of our key agency, one of my deputies is transitioning to and leaving the agency. So I spent some time in the office with her today. So I was thinking about change. So I Googled songs about change, and Winds of Change was the first one that comes up. So that seems probably appropriate for the
Very
moment.
apropos. Yeah. Well, change is definitely bittersweet for sure, isn't it? I realize I forgot to introduce some of our staff who are participating today too. So I'm going to do double duty and ask Betsy and then Michael Andersonnathan to both introduce themselves and offer their song or movie. So Betsy, you could, or you could punt, you can say no.
You know what, Jamie, I just had a premonition that I was going to get called on at the last minute for a song. And I do what Michelle does and my mind goes blank. So we'll see. So hello, everyone. I'm Betsy Jones. I'm the managing principal with Health Management Associates Seattle office, and I'm leading on behalf of the health management team and the Behavioral Health Institute at Harborview, this 1477 work. So nice to be here. And Jamie, I can't do it.
That's okay. If you come up with it later, throw in the chat. And then Michael Andersonnathan, and you're also off the hook if you don't have one today.
Thanks. Hi, all. My name is Michael Andersonnathan. I'm an independent consultant collaborating with HMA on this project, and I support around our equity, diversity, and inclusion efforts. I use he, him, his pronouns. I actually have a movie, and today has been a day of family. I've been doing lots of family phone calls and handling stuff. And so the movie that comes to mind is The Joy Luck Club, which is a great movie if folks haven't seen it. And so it kind of summarizes my day. It's steeped in family.
I get it. Yes, that's a good one. I realized that I actually can't see the chats here. So I'm wondering if Anne or Nicola are seeing any chats from members or any of our guests with some of their contributions.
I don't know if the chat's on, Jamie. I can only.
Yeah, it looks like it might not be.
I don't think it's
all
on.
right. Well, I am so sorry, guests. I wanted to hear from you, but I think we might be having a chat technical difficulty. So we'll correct that for our next meeting. So save your great movies. I know, gosh, I agree. Save your great movies and songs. At first I was like, oh, people really hate that question. Nobody's responding, but it turns out they can't. All right.
Sorry, I was going to say it might be because it's direct messaging to you. So
That's
like, I
all-
don't know if you, yeah, so I don't know if like you want to turn it to everyone, because I left a movie, which was Braveheart, because of his bravery.
Oh, thank you, Roxanne. Yeah, I don't think there's any direct messaging to me because I'm not getting any, but we'll fix it next time. Thank you for that. And yeah, if everyone can think about that question for next time, we'll definitely try that one again. Let's move on to finalizing our plans for the November 16th CRIS committee meeting. So we sent steering committee members our draft agenda for the CRIS committee meeting next week with your meeting materials last week. Nicola's going to go ahead and share it on the screen. This will actually be our second, just to create a not Groundhog's Day. This is our second time looking at this. Just want to confirm a couple things with you that we responded to. When we looked at this on October 12th, we got feedback from you that you really wanted to see more opportunity for dialogue and engagement of CRIS committee members with each other. So we've really reoriented this agenda to try to create that space. So Nicola, if you could just scroll down. So the objectives haven't changed a lot, but how we've laid out the meeting has changed a little bit. So if you could scroll down, Nicola, that'd be great. All right, so let's stop at the 115 because I want to talk, or actually 105. Let's talk briefly here about a couple of things. The first question I want to ask is confirming who of our steering committee members would like to give the land acknowledgement at our next meeting, and also who would like to give the welcome. So let's see, so far we've had Carrie and Michelle do land acknowledgements. Would any of our other steering committees members like to do it for the CRIS committee meeting next week? If you want to let me know later too, that's fine. Let's see if I can see you here. All right. You know what I'll do is I'll just follow up with each of you directly. That might be easier rather than taking time here to do that. So for the personal stories, I just wanted to update you on how we've sorted that out. The feedback that we heard when we met with you on October 12th was that we wanted to create a really safe space for offering these personal stories. And as part of that, it would be helpful to have more than one. So we have 2 personal stories. Actually, one of our CRIS committee members has offered, with lived experience, has offered to share their personal story at next week's meeting, as has Jim Volendroff with Behavioral Health Institute. So those are going to be our 2 personal stories. One of the things that we did last time that we're going to do again is meet with each of them ahead of time, both to talk about their story, but also talk about how they want it approached from an introduction standpoint and also a closing standpoint. So we met with our CRIS committee members with lived experience, and including Bipasha, and got some really wonderful feedback on how to do this in a safe and respectful way. And one of the suggestions had been, or pieces of feedback had been, that everyone has, different individuals have different needs for how they want this to be handled. Some would like to offer their story with their camera off and then not have anyone say anything, and others would prefer to have some acknowledgement of their story at the end. So those are examples of different ways that people might experience them. Another piece of feedback we heard is that our guests and people in our meeting guests also may be experiencing hearing the stories in different ways. So we want to be respectful of that. So I'm having a prep meeting with each of our story offers to prepare, and I will follow up with the steering committee when I understand how they want their stories both introduced and concluded. But again, I will be following up with all of you by email. I would appreciate it if one of our steering committee members would be willing to both offer the introduction and the thank you at the end. So think about that. Basically, I need 3 steering committee members, 1 to offer the land acknowledgement, 1 to offer the welcome, and 1 to offer the introduction and thank you for the personal stories. So I'll be circling back with each of you shortly on that. Any questions? I want to pause there. Any questions on how approaching that or feedback?
I just want to say thank you for your really thoughtful approach to that and checking in with each person. I'm happy to help out if you need anyone.
Thank you. I appreciate that, Representative Rowe.
Is this the agenda for next week?
This is Roxanne, and if you could just keep your mic on mute. This is for steering committees.
Okay, sorry.
Yeah, no, that's okay. I appreciate it. And if you have any questions, please do throw them in the chat. Hopefully, one of our team members will see it and we'll correct that. Other questions or feedback from our steering committee members? All right. I'll keep going then. So we'll do the usual.
Jamie, I was a little
yeah,
bit
sorry, Michelle.
raising my hand. Yeah, I second the thankful for your approach. And I think over time, I mean, right now it's great for us, but it might be over time nice to ask other CRIS committee members, not just steering committee members, if they wanted to do some of those roles as well. But otherwise, I feel fine just, and I may be speaking for everybody else, for you just assigning steering committee members, rotating us through. Just, yeah, let us know how we can help, and let's think about expanding it over time as we have.
I appreciate that. Yeah, I think once we set the stage and sort of how we're doing it, that's a really good idea. For this first one, you can all model it, and then we can start to open that up and be a little bit democratic about how we approach that. So thank you for that. And thank you, Michelle. I will volunteer you then when you're going to be doing one of these roles. All right. So, Nicola, if I could ask all of our participants to make sure your mics are on mute, that would be great. Thank you. All right, Nicola, if you could just scroll down a little bit. So we've really shortened the timing on the updates. We're going to try to send out materials to prepare folks so that we don't need to use very much time on updates. And this will just really free up time for dialogue. At 1:50, we're going to be doing breakout groups around the comprehensive assessment. And we'll learn a little bit more about how we're approaching this, but we've organized this around key themes. The breakout groups will be facilitated. We're going to spend very little time on presentation. We're going to send out materials ahead of time so that people can be prepared to just dive right into discussion. But again, we'll update you a little more on that shortly. We'll take a break at 2:50, and then at 2:55, we're going to do another breakout discussion around centering equity in our work. And this was in response to feedback we received from you at the October 12th meeting about wanting to carry on the conversation we started there with the CRIS committee. And so now I'm going to ask Michael Andersonnathan to just speak briefly about how we're approaching that discussion. Michael?
Yeah, thank you. So, in the spirit of, bringing in the rest of the CRIS committee into those conversations and creating more opportunity for meaningful dialogue in breakout groups, we've structured this activity to really kind of respond to that. So we're going to really kind of focus in on continuing to build that foundation of our understanding of equity, so that for the next 2 years, the committee can successfully embed equity in the work of this behavioral health redesign. And so we're primarily going to do this in breakout groups and have them tackle 2 key questions. So we'll set some stage around kind of reminding them or grounding them in the work of the committee and from the charter, and that commitment to equity statement that's in there that's saying that they're going to center equity. And what we want to do is have small groups of CRIS members spend time together talking around, what does it mean when we say we're going to center equity? In particular, looking at kind of key questions around like, what the statement means, what kind of tangible actions we would see from doing that, and what they need as a committee in order to enable them to do that work, right? So that'll be the first part of the breakout, is a conversation around that. And these are going to be facilitated conversations, so there'll be someone there capturing the notes so that we can kind of take that to use moving forward. And then the second part is we're going to have them review those starting kind of equity values that the steering committee talked about last time, and we're going to present them as, here are some starter values that have been identified that we're asking CRIS committee members to refine and work with. And so we're going to have them look at those, and we're going to have them answer a few key questions around, do these values resonate with them? If so, why or why not? And then what other values might be missing that need to be included in order for us to be living into centering equity. And so that's what the CRIS committee will be doing. And that way we're getting their input. They can have some meaningful dialogue in small group settings. While that's happening, we're going to do the same conversation with the public in the main meeting room using a combination of chat feature and some verbal input from the community members. And then we'll take all of that after the meeting, and we'll kind of process it and kind of synthesize ideas and bring it back to the group. So and that is the approach, and hopefully that kind of meets the needs from the last steering committee and kind of how you want this to go moving forward with the CRIS.
Thank you, Michael. So we'll pause there. And are there any questions or feedback on that from our steering committee members? Everyone good? All right, wonderful. So then after that,
Sorry, Jamie,
Bipasha, please. Yes.
I did want to bring this up. I know we're talking about the CRIS committee agenda, but since we brought up the issue of equity, I did want to pose two questions, more in terms of so that we have on record some clarity around. So everyone who is doing this, barring the people who are doing this out of lived experience, y'all are doing it as part of your job. So part of your job means you'll get paid to do it. But the four of us who are not doing this from the perspective of a role at a workplace. So I wanted to pose the question about equity in terms of, I can well afford to be here in terms of time and financial stability, but somebody else can't. So the question being, why is it not possible to pay people to be part of the committee? That was one question. And the other thing is, from what I understand, the four of us are also non-voting members on the committee. And if that can be addressed too. And I'm not saying that we can change things, but I think it's important to bring it up, and so that people who are listening in or listen to the meeting later can understand how this stuff works, basically.
I really appreciate you raising that, Bipasha. Thank you. And folks, just for clarity, this question of compensation for our members with lived experience has come up before. I'm going to ask Betsy to speak to that. I also want to clarify Bipasha's second question, which is just in Bipasha, correct me if I'm misunderstanding, but I think the second question is, why are you not a voting member on the steering committee, correct? Because the lived experience folks on the CRIS committee have the same power as everyone else on the CRIS committee.
So maybe I misunderstood. Is everybody on the CRIS committee? Is there any distinction between voting and non-voting members on the CRIS committee?
The CRIS committee is not really a voting body, it's a providing input body. It's the steering committee that will be at some point making decisions about what recommendations go up to the legislature. And so you are correct that currently you are not a voting member, and I appreciate you raising that. I'm going to ask Betsy actually to speak to both questions, and maybe our steering committee members can weigh in as well. So Betsy?
Yes, and I'll cede the floor first to Senator Dingra. If you would like to say anything, I'm happy to fill in gaps, but I also want to give steering committee members an opportunity if they want to speak to these questions before I jump in.
Thank you.
Yeah.
Thank you. And thank you for raising that, Bipasha. This is something that has come up not just in this group, but a couple of the groups that I've been involved with, specifically the Governor's Poverty Reduction Task Force. The same issue came up because we do want individuals with lived experience to participate, but you're right, the compensation isn't there. And this came up also in the criminal justice, in the criminal sentencing task force. So we do have individuals taking a look to see how we could possibly provide compensation. There are state rules around direct contributions to individuals or considered gift. So we are looking into it. We're really trying to see how we can try to formulate these task forces in a way that people with lived experience are compensated, because you're right, it is a huge equity issue. We, over the years, have started to really value individuals with lived experience. We try to incorporate them into all the work that we're doing, but there is, we don't provide that compensation. So it is something I know I'm very interested in looking at. I know others are as well, and we'll keep this group updated, but just know that the Poverty Reduction Task Force has also been tasked in trying to see how we can get around our current laws about gift giving to compensate lived experience. On the second component, I'll just say that on the steering committee, and I think I mentioned this briefly at one of the other meetings, we did not have a system of having 4 co-chairs. This is something I was very interested in making sure we had someone with lived experience who was a co-chair. And this was one of the things that the last minute bill drafting kind of didn't make it in. And so what came into the bill was just that the co-chairs will be picked from the steering committee, instead of what my intention was, is that a person with lived experience could be co-chair and would be part of the steering committee. So the steering committee issue was definitely a drafting error, and that is one that I am interested in seeing if we are interested in fixing it. I will add one more thing about the voting on the steering committee. This was also done in a way to make sure that there is some accountability and transparency for the process. So the people on the steering committee who are currently voting members represent everyone that is going to be in charge of implementing the recommendations, basically saying the buck stops here. And that is the President, House, the Senate, Department of Health, and HCA. And so this really is about making sure this is not just yet one more task force that comes up with recommendations and people don't see them being implemented. So I'm really hoping that this structure is going to provide that accountability.
Thank you, Senator Dingra, and then Representative Orwell.
Thank you, and thank you, Senator Dingra. And we're very fortunate to have you here. I think guiding the process is really important, and to have the voices of people with lived experience. And I am very open to any fix. I'll work with Senator Dingra to fix the voting membership. Would love to see that change. I am on some statewide committees supporting survivors of trafficking, and they do pay the members. And what they do is, I think the money goes through nonprofit entities. And so let's look at that. It would be nice to fix that as well. Thank you.
So I think my takeaway from this, and thank you both, Senator Dingra and Representative Orwell. I think my takeaway from this is that we should continue to look for creative ways to address this situation, and both of our legislators are going to be pursuing ways of addressing it at the legislative level. And Anne, who is our wonderful meeting back end person, just let me know that she has corrected the problem with the chat. So if you need to put anything or want to put anything in the chat, you may. Just a reminder that I am not going to be able to monitor it while I'm facilitating every second, but I will check and try to catch things. And I do actually see a couple of questions in here that Anne forwarded me that I will answer in just a moment. First, I want to call on Mark and then Bipasha.
Right, Bipasha, I wanted to just chime in that consistent with what Senator Dingra said, I'm actually not a voting member of the steering committee either, because I don't have ultimate responsibility beyond this current process for the recommendation. So I want to make it clear that it was not just your position on the steering committee that's not voting, but mine is not a voting member.
Thanks for that clarification, Mark. And then Bipasha.
I also want to clarify, I wanted this for the record, because if I was just a resident of Washington watching these things, as I often am, I'm like, what is this? Doesn't make sense. So I want this to be on record, so if people go back and listen, I want them to know that our legislators are working on it. That's also important to acknowledge. And there's a lot of political process that's often very difficult to decipher. So my intention, I actually had a talk with HMA. I've also talked to Manka. So I know the reasons. I just wanted to bring it up so it's on record. And it's not so much for my personal, I will say that I come to the space with a lot of privilege despite being an immigrant woman of color. I am always thinking of people who have much less privilege but would like to be part of this process, don't have the time, and couldn't do it because that would mean they can't work a few hours of the day and make the income they need to support their families and children. So
thank you, Bipasha, and really appreciate you bringing this up. Betsy, are there any, I think we covered a lot here, but are there any gaps that you would like to fill in that we didn't cover?
No, I think we did a good job, and I'm glad that I deferred to the steering committee members. The only thing I'll say is that we have been very aware of this issue from the beginning, as Bipasha knows, and have explored any kind of way that we can get to good with this, and we'll continue to do so. So just appreciate all these comments.
Thanks, everyone. All right, so next steps on there, we're going to continue exploring if there's other creative ways that we can address this, both on the practical side of things and on the legislative practice side of things, rather, and the legislative side of things. And we will keep steering committee, we will keep sharing information, steering committee and the larger group apprised of how this advances. So thank you for that. One other thing I just wanted to raise with respect to the agenda, and this is me, your facilitator, asking you, particularly the co-chairs, the 4 co-chairs of the steering committee, I'm sorry, of the CRIS committee. One of the tensions that we're going to continuously need to navigate is time. These meetings are 3 hours, which seems like a lot, but then when you start to break it down into the welcome and the introductions and the relationship building and the stories that really ground us in our work, and breaks and public comment, the meeting minutes start ticking away, and it becomes more challenging to preserve that time to actually have dialogue between the CRIS. So the HMA team is really working on how they can not have to do so much presenting or speaking, one-way speaking, and really preserve time for conversation. But I also am going to ask, particularly our co-chairs, I'm going to lean on you a little bit to help me also be thinking about how we prioritize and how we make sure that we are preserving that dialogue time for our CRIS committee members and giving space for that dialogue. And that may mean sometimes that we say, I know we're up against some deadlines, but we really need to have a longer conversation about X. So we're going to move some of these other things to future agendas. It may also mean that we're hearing from the community that there's some urgency around some certain things and we don't have that time. And so we're going to need to speed that up. And those are the kinds of tensions that we're going to have to navigate together. But I just wanted to put that on the table and say that's going to be an ongoing conversation that I think this group's going to need to have, and that I, as your facilitator, am going to need some support from our co-chairs in our meetings to really protect that dialogue time. Any feedback on that, or questions or concerns about that? Pasha, I'm not sure if that was your hand up from before or if that's a new one. Sorry, I don't seem to have my controls here to be able to lower hands, so I apologize. Yeah. Everyone okay with that? All right. Well, we're pretty much close to time here, so we're doing all right. Let's move on to our subcommittee update then. I'm going to turn it over to Betsy, who's going to share progress on seating these subcommittees. Betsy?
Thank you, Nicola. I believe we have some slides to share. Okay. Can we go to presentation mode?
Yes, just one moment. Working on that shift.
Okay. While you're doing that, Nicola, actually, there's a question that got forwarded to me from Anne that came up in the chat, which is the meeting that's being discussed for next week. Is there more information about that? I don't see it on the CRIS website. And that to respond, that is the next CRIS committee meeting. It's next Tuesday, the 16th from 1 p.m. to 4 p.m. And I believe that HCA is going to be posting the agenda and meeting materials and registration today. So hopefully that answers the question for next week, but we can also check in and see if we can maybe get, since all the meetings are actually scheduled ahead, we'll just confirm to make sure that there is a meeting schedule on there so that folks can plan ahead and know when there's going to be a CRIS committee meeting.
And Jamie, there is a meeting schedule
Oh,
on the
great.
website. I think the materials will be shared by tomorrow, just with close of business and time to post to the website.
Okay, all right, so look for that tomorrow. And if you're on the email distribution as well for this committee, you should be getting an email with a link to register for next week's meeting. I will stop talking now and give it back to Betsy, sorry.
Great, so I have a subcommittee update for you, steering committee members. The good news, I mean, it's all good news. We're working feverishly to get these subcommittees appointed and stood up in time for a late November all subcommittee meeting, which will really focus on the current state, where we are today, work that has been done to date with regard to the 1477 implementation between DOH and HCA and the work that HMA has been doing. So we'll have a nice presentation for all subcommittee members in kind of I believe it's just before or just after Thanksgiving. We're settling on the date there. But logistics aside, I want to let you know where we are in terms of our subcommittee appointments and the status of the work. We got about 315 applicants across all of our subcommittees, it's just a tremendous amount of interest for this work, probably not surprising to all of you. And we have, you can see the breakdown here of the broad stakeholder statements of interest. Oh, actually, we had 327. We have been thinking about, we're applying some criteria in order to make these appointments. And I'll speak to that just in a moment, but really want to point out that we got a number of statements of interest from the cross-system crisis response subcommittee, 135 statements of interest. We have 82 statements of interest from lived experience. So we're working through each of those subcommittees, and we hope to have those appointments done by this coming Friday. For the Tribal 988 subcommittee, we're working with the Tribal Centric Behavioral Health Advisory Board, which is a group that already exists for the tribes. And we will be using their mechanism to do the work of the Tribal 988 subcommittee. So we're working closely with Lucy Mendoza and others to get that work started. And then aside from the broad stakeholder statements of interest, we have been identifying agency staff who will be subject matter experts and other folks within the agency involved in the beginnings of the implementation work. We've been collaborating with DOH and HCA. We've also been talking to the BHASOs and the call centers to identify implementation agency staff, because those folks will be so deeply involved in implementation as well. So we have folks on the staff side, and then we have folks on the community and professional expertise side that we're culling through. Next slide, please. Just to remind folks about the approach to forming the subcommittees, we identified with you all a couple of meetings ago, I believe, some subcommittee membership criteria. You'll see that criteria here. And also we're thinking about tailoring subcommittees to meet the needs of each subcommittee rather than being strictly being rigid in terms of the number of folks we need. So I think at the last subcommittee, we talked about 6 or 8 broad stakeholder subcommittee members for each subcommittee. And we're thinking that for cross systems, for example, you saw 135 applicants, and it's a very broad stakeholder base as well. So we're thinking that that will likely require a larger group. So we're contemplating that. And then with the lived experience subcommittee, we're welcoming anyone with lived experience who would like to join and participate in that subcommittee. Additionally, subcommittee members could change over time based on the topics under review. For example, in early days, we'll be looking at 988 implementation as an initial focus. So the launch of the line in July, and contemplating what we need to consider for that launch, for that date, versus system redesign efforts that will be ongoing, beginning in 2022, but will continue beyond the launch of the line. So we may be adding subcommittee members and even adding subcommittees as we move forward. Next slide. And here I'd like to just bring forward, just for your awareness, not to do anything with today, beyond just knowing that there's been a request for a new subcommittee, a funding subcommittee. And we've been talking to Greg Hannon, who's a lobbyist working for a coalition of telecom companies that have been engaged in in House Bill 1477. And the request really is about bringing together a group of stakeholders, including those telecom folks, to understand the funding for the line for 988, as well as for crisis system implementation needs, and to be able to come together and speak to that and understand what we're thinking as we go forward with regard to funding. So that's on the table. Just wanted to bring that to your attention. And as we understand the results of the findings from the comprehensive assessment and begin our planning in 2022, we will be considering a funding subcommittee as well. So that's news today. Rep. Orwell has a question.
Well, no, I wanted to say, I know Greg Hannon had approached me and obviously needed to coordinate directly with you. I do think that this is an important one to have a focus on funding. And when I think about the legislation we did, you know, it has a built-in audit to carefully look at how the dollars are spent. You know, so I'm not opposed to this. I do think it does need a number of legislators and maybe some of our legislative staff to be involved in this group as well.
Yes, and I think it's important that we have this on our radar and then consider how to, you know, best address the request and the concern in 2022 as we begin subcommittee work in earnest. Okay, next slide, please. So I guess that's it for that agenda item. I thought I had one more slide, but I don't. So yeah.
Why don't we pause there? It looks like Bipasha
Yeah,
has a question.
Bipasha has a question.
Bipasha?
I'm just gonna come out and say this, that the funding subcommittee, just as a regular human being, I'm very much in support of being accountable for dollars spent, but I also want to say that I do not want this process compromised because Big Telecom doesn't want to charge us the small amount of tax in order to make this process work. Money is needed, and I'm sure you'll all read that according to the advisory, the 988 thing didn't pass, which was very hurtful for me to see during this election. But I want to just put out a note, a statement to these people that, you know, bring your best intention to this process of helping us make the system work and not constantly blocking the process, please.
Pasha, what I'll say is that having spoken to Greg Hannon on behalf of the telecom folks, he was very clear to say to me that they are in support of the work, and their desire is really to be at the table and understand what's happening so that they can navigate as well as everyone else is navigating. So I feel that it's my responsibility to speak to that, because Greg was wanting to be very clear that it's not opposing, it's really wanting to be at the table. So, and they thought that the best way to do that would be to be part of a funding subcommittee, because telecom is, you know, backboning the funding here. So
thank you.
To share that, yeah.
I think my takeaway too from what Bipasha just said is that as we're selecting subcommittee members, we need to be mindful of choosing people that may be representing a perspective, but are also there to make this work. Is that an accurate summary, Bipasha? Great, thank you. Okay, I see two hands. So Representative Orwell and then Senator Dingra.
Thank you. And I understand those comments. I was going to say that, you know, the telecom, Greg and telecom, they have reached out. There is going to be a small group called the launch group. Telecom does potentially have some resources. I think it would be nice to get a messaging out to the community about 988 in a way that's positive and gives people hope, right? Hope that when people are in crisis, we're creating a system that's going to be much more trauma informed and responsive. And so I think it's going to be so important to get that messaging out. And I appreciate, Pasha, your comments and your sensitivity I think if the average person knew how these dollars were spent, they would know it's going to save lives. So thank you.
Thank you, Representative Orwell. Senator Dingra.
Thank you, and thank you, Bipasha, for mentioning what you did. I will say, that Representative Orwell and I met with Telecom every other week during session, and they did participate in good faith in this process. And they do have an important role to play in this. But I will say this is not something that Telecom is footing or paying for. These are individuals. These are every Washingtonian pitching in to help pay for the system. So this is not a burden on Telecom. And it is pennies that we're asking people to pay for a system that is going to save lives. And I cannot tell you how many people have said, even if I had to pay $1, I would gladly pay $1 a month if it means we can have a crisis system in the state of Washington that meets the needs of individuals. So this is far below the dollar that I know most people are more than willing to pay a month for the system. But I think, this is a process that has to go on. We're committed to it in the state of Washington. And I think anyone who is willing to be solution oriented and help Washington develop one of the best crisis systems should be at the table.
Sorry, I lost my mute button there. Thank you, Senator Dingra. Any other feedback on the subcommittee updates before we? All right, really appreciate all those comments, and Bipasha for raising that issue. Let's move on next to, we're a little ahead of schedule, which is great. Also, I just wanted to acknowledge that I took a look at the HCA website, and it does not appear that next week's meeting is on here, so we will get that corrected. Thank you to the person in one of our guests who raised that. And our apologies for that not being on the website. We'll make sure that that gets corrected. Let's move on now to the update on the comprehensive assessment report and timeline. And Betsy, you get to keep going.
I'm up. Okay, so we want to share with you just a progress update in terms of where we are with the comprehensive assessment, a little bit of status. Next slide, please. So we've been going, HMA, Health Management Associates, your friendly consultants, have been working very diligently to do some discovery to help inform the comprehensive assessment. And the rows that you see here represent bodies of work that we've been undertaking over the last few months. We have been working on holding community forums. You'll see that we have had 5 community forums here and really robust participation, great feedback from stakeholders that we will be incorporating into the comprehensive assessment report. Additionally, we've done a crisis system and services survey, which was distributed to all the BHASOs and behavioral health providers. All the BHASOs completed the survey. We had a number of providers also who completed the survey. It was really targeted at the ASOs, being those regional entities for crisis services. And we just had a really great response. And then additionally, we're able to do interviews with all of the BHASOs to follow up on the survey results and to understand better their comments and the data that they provided with us or provided to us. And then we conducted interviews with all the MCOs. We've done 4 to date, and we have 1 remaining to be done. And those interviews as well were really instructive and helpful for us in developing some of the assessment findings. Further, we've done data analysis and review of other reports, and you'll see those reports listed here, and have been combing through other reports and resources as well. The HCA's contracts with the MCOs and the BHASOs, a preliminary report on the 988 I have to pause for a moment because I'm seeing some chat that's blocking my screen. So I'll just wait until the chat pops down. Okay. Preliminary report on the 988 case referral and management system that third sector completed for the Balmer Group. The vibrant 988 landscape analysis and implementation plan, which is a big body of work that we are incorporating into the comprehensive assessment. And then we've been doing a national scan of crisis delivery best practices. So really important to inform the report with what else is going on in the nation and how might we think about best practices as we develop our implementation plans and think about enhancing and improving the crisis system. Next slide, please. So here you have a timeline for review for getting some more feedback for the comprehensive assessment and then the development of the final report. So on November 16th at the CRIS meeting, this will be work that we're doing next week. We're going to get feedback from all the members on comprehensive assessment key themes. So we'll be bringing forward 9 key themes that we have gleaned from all of our conversations and from the data that we have been reviewing and from stakeholder feedback, and asking CRIS members for their thoughts about the themes that we have that we will be introducing, as well as some sub themes. So we'll have a conversation, and as Jamie mentioned, breakout groups to really gather some more information from CRIS members. And then we'll give folks 2 weeks until the 30th to provide some feedback on the themes that we present next week. And then we'll be working very, very hard at producing a final report. We'll have a draft report for steering committee approval on December 20th. And at the same time, we'll be asking CRIS members to comment, and we'll give CRIS members 3 weeks to provide comments on that report. And what we'll be doing with CRIS member comments is posting all the comments publicly as a companion to the report on HCA's website. So we will be then asking the steering committee on the 27th for approval to submit the final report, and then submitting the final report on December 30th. The report is due to the legislature and the governor on January 1st. And so just want to mention that the 3-week period between December 20th and January 13th is to enable folks really to dig into the report and provide feedback to the extent that the CRIS members are able. And knowing that it's the holidays, we want to give just plenty of time. And because it's a companion to the report, we felt like we could go beyond that January 1st date and allow for feedback to come in a couple weeks, after that January 1st date. So that's what we have in terms of our timeline for the comprehensive report, hoping that this will enable lots of feedback and the ability to incorporate more stakeholder information.
So let's pause there. I see actually a couple of good questions coming in from our guests, but before we dive into those, I'm going to check with our steering committee members. Any questions or comments so far? All right, let's take a quick look at these questions coming in from folks who are participating today. So 2 kind of related questions, Betsy. Do we plan on conducting interviews with providers and or people with lived experience and their family members?
So we have been conducting stakeholder meetings with lots of folks, with providers, with family members, with people with lived experience through our community forums. We've had a lot of really great feedback, and we're taking copious notes and incorporating that information into the assessment report. So that's the mechanism we've used, the community forums, to do that, to get that information.
Okay, and then is the data analysis going to include forecasts of potential need and demand and workforce capacity zip code, by zip code county, race, ethnicity, and gender, and other key metrics.
So that information is work that we'll be doing in 2022. We're waiting for some claims and encounter data that will allow us to really dig deeper into race, ethnicity, geographic, subpopulation data. We don't have that currently. So we're pending that information for discovery in 2022. And HMA will be continuing to work with HCA and others to gather the information that we need to make those deeper analyses. And we're anticipating that the CRIS committee will be asking for a number of data analyses and assessments, and we'll be working to deliver on that as we go forward and start doing some of the redesign work.
Okay, great. And then there's a question actually from one of our CRIS committee members, which is there an opportunity for a CRIS meeting to discuss the full report and not just the themes?
So we are going to be, as I mentioned, talking about the themes next week, and then need the time between that CRIS meeting and when we deliver the report to actually write the report. And so our solution, and we're trying to be as elegant as we can, is to offer CRIS members 3 weeks to absorb the report and provide information. And then actually, as I mentioned, we're going to be posting CRIS committee member feedback on the HCA website as a companion to the report. And in so doing, we're hoping that we'll have our report from HMA, and then CRIS committee member feedback. We'll take that into 2022 and have lots of conversations at the CRIS committee about what the report is telling us, how we feel about that report, what it's indicating to us that we need to do to move forward in 2022 and beyond.
Okay. Another question, are you going to develop models of current response and care pathways to show what is happening today, as well as visuals of desired response and care pathways to inform new crisis response models and what is required?
So I think that is really good information to take into 2022. That sounds like a recommendation for how we might model future state. I think that will be work that the subcommittees will dig into, as well as discussion at the CRIS. Just to remind folks, to level set, what we're doing right now is trying to understand the current state of our crisis system, and also model a little bit about what the 988 line will cost with projected volumes. And once we have that information about, okay, this is where we are, we need to figure out where we're going to go. And that will be the work of the design and implementation recommendations. So I want to be clear and just provide that little bit of level set about what we've been able to do to date versus what we will be doing in the future.
Thanks, Betsy. That's the end of our chat questions. I'm going to go back to our steering committee members and see if after those questions, if they have any additional questions or comments. Okay. Right. Oh, Representative Bortwell.
Sorry, I'm a little slow finding my hand.
No, that's fine.
Well, I tried to get your sense. I know you're doing a lot. There's a lot of moving parts, getting the subcommittees up and running. What is your thought about the subcommittees? Do you think any of them are going to have some recommendations for us going into this short session?
So that is a very good question. I think that we will get some recommendations from the Tribal 988 subcommittee. Absolutely, and I know that was a special request. And in talking with the tribes, I know that they have some thoughts to offer. In terms of the other subcommittees, I think we need to dig in beginning in January and figure out, where are we with the subcommittees and what are we asking and tasking the subcommittees to do? So, you know, the way that I've been thinking about it is we need to understand the current state. We do that with this January report, and then we begin to work with the subcommittees to think about what we need to start to begin to enable. You know, what do we know about the current state? Are there near-term recommendations that we can make? Maybe it's, you know, more of a broad brush in terms of, we know we need this additional resource. That is not, you know, there's no question about that. And then more of the design elements come later for future legislative sessions. So.
Michelle.
Betsy, well, everybody, this is really appreciate the work to get such a comprehensive start on such a short timeline, knowing that there's a lot coming over the next, this is our starting place and a lot of work we need to do comprehensively together. One question is, just want to loop back to the National Suicide Prevention Lifelines, who will be answering the 988 call starting next July, and wondering, I know that's part of what you're getting from the Department of Health and the Vibrant 988 landscape and others, but wondering if they're included in any of the other interviews or other pieces you're doing, or hearing from those call centers too would be a potential, or if you're just getting that information, which I know there's a lot in the information the department's providing you.
Yes, we have, I think, Michelle, we've been relying on the implementation report, the Vibrant report, to get a lot of the information about current state with call centers. But we will take that back and make sure that we're not missing something as we, formulate the initial kind of landscape. Thanks for that flag.
And I just want to note that we're also seeing some more feedback in the chat that about getting having more opportunity to get input from providers. So some feedback that it would be good to get more than what we've gotten so far in this stuff from providers is what I'm seeing here in the chat.
Yeah, and I also want to say that we are moving as fast as we can to get as much input as possible. And I don't consider this report in January as the final word. I think, I want us all to remember that we have a very collaborative process underway. We're going to be flexible with, to Rep. Orwell's question, what funding recommendations might be coming forward from subcommittees? What can we do now? And what can we contemplate, and how do we make sure that we are bringing folks in as much as we need to along the way? So if we don't get someone's feedback for this, this first assessment report, what do we need to do to, continue to make progress reports? We have another progress report due in January of 2023. HMA will be working all along the way to make sure we're listening, we're incorporating feedback, what we are missing. And we're hoping that this 3-week period of comment, when you see the report, we'll be able to incorporate more perspectives, more feedback, and we'll continue to, improve upon what we deliver initially, because this is a really dynamic process that we're all engaged in. And I'm sure that everyone can appreciate how complex our system is. And if we're not touching everything initially, let's just be talking about it and making sure that we're getting the information we need, and just keep the comments coming. And we'll continue to work with the community and you all, to incorporate the things we need to incorporate.
That's great. So my takeaway there is this is ultimately a living analysis that we'll keep building on as we go through this process.
Yeah, I can't emphasize that enough, Jamie. Every day I'm hearing new things that are really relevant. Every single piece of information has a home, and HMA is trying to figure out, using this framework, this basic framework of key themes that we've identified with the feedback we've gotten, which has been a lot, but certainly not universally complete. Using that framework, we move into 2022 and start the work of really digging in and saying, what is this telling us? And what else do we need to know, right? The CRIS will be asking for data as we go along, more analysis. We're just going to be learning together. I think this is a learning community that we're engaging. So I want to ask for a little grace as we struggle through. I spoke with, I think it was maybe Michelle this morning, and we were talking about how this system has, oh no, it was Charissa. It was Dr. Fotinos this morning who was saying, we've been working on this crisis system and making improvements to this crisis system for decades. There's been a lot of good work. We absolutely need to improve things. And, we need to acknowledge that everybody has a piece of this, and, we're just working together. So that's my message.
Indeed. Well, and I want to note that we are going to be recording this chat. There are some great suggestions in here and feedback on what we can do to continue to create the living document or living analysis and build on this. So we're going to record this and make this part of the record of today's meeting. There's also some good links in here, so I want to make sure we capture that. Steering committee members, any more feedback on this topic before we move on, or questions? So I just want to capture one kind of thread in the chat conversation. I know all of you can see it, but I think it's probably worth saying out loud too, which is there is some strong interest in doing analysis of both where the system has broken down and also where it's been successful so we can replicate it. I think that's a really important point. Representative Orwell.
Yeah, you kind of, you went just where I was going to go, which was in the thread. And I do think that's important, is get that deeper understanding and conversation about the current system. I also, one of the things, and I know we don't have a subcommittee on it, and maybe it's captured somewhere else, but really understanding the crisis team response. It seems like one of the key elements, and maybe this moves us into next year, is really, if we don't have a rapid response to that small percentage of people that need a rapid response, 911 will continue versus 988. And so I don't know how that gets, which group that gets part of it. Is that part of the first responder group to tackle that, or is that a separate committee? But I think that's going to be also tied to that next step in funding is really our crisis team. So trying to figure out where that's housed, I think would be important.
And, Rep. Orwell, what you're speaking to is something that I've been thinking a lot about. It's really how to think about the subcommittees and take the comprehensive assessment and what we have identified as, kind of our framework and our go forward, and think about how we identify the bodies of work that we want to focus on. And do we have the right subcommittees? How would we want to task the subcommittees that we do have with pieces of work? And then what else do we need to gap fill? So I really think about the subcommittee work and the work of 2022 as, really designing, setting the stage, figuring out what the palette looks like, and then asking, our stakeholders and our professionals and experts to dig into some of the findings, help us to uncover more opportunity, and then just be flexible around the design and the disposition of those subcommittees so that we can get the work done. So I fully anticipate that, and in talking with, lots of you, that it will be, these subcommittees are dynamic, right? We're gonna learn more after this assessment about where we need to go. And I see that Mark has his hand up.
Yeah, I was actually going to follow up in what you were saying. Just like the report in January is not the end of our analysis of the current state, but really the beginning. of the discussion that will go on for the CRIS over the, I think, probably duration of the project. I think the same of the subcommittees. I think these are the starting subcommittees. And what I was excited about is, given how much interest there is, I think there will be more than enough energy and people that as the process unfolds, we will identify other subcommittees, because I think the cross-system subcommittee is a really complicated area, and it probably at the end of the day may spawn 3 or 4 subcommittees that look at very unique pieces of the interaction between 911 and 988 and other parts of the system working together in terms of the hubs and the mobile crisis outreach folks.
Yeah, I actually love the idea that what we will have in January is our basic frame. It's like our chassis, right? We'll have some, we'll make some observations about the current state of our system. We'll understand the background. We'll have some recommendations for best practices. And then we'll take this creative process into 2022 with our subcommittees, our CRIS, our steering committee, all the stakeholdering, and start to figure out what we do with that framework, right? Where, you know, like I said, what are the opportunities? What are the gaps? What else do we need to, you know, to dig into? What kind of data will help inform the questions around regional differences, around subpopulations, right? All of those things that we're all so curious about. That's what we get to do in 2022. So this work right now that I've been talking about, this assessment discovery process, is really table setting. So I would ask, you know, all of you all out there and our CRIS members and our steering committee members who are members of the CRIS to come into the meeting next week really with that lens of, these are themes, what are the big themes that we're missing, to be able to frame the conversation that we need to have in, you know, beginning in January. But it's not going to be the be all end all. It can't be, again, right? HMA cannot possibly deliver a report that captures every single thing. That's what we need you all, you know, around the table to help us frame and move forward. So, and there are just so many great advocates and interested folks participating in this process that I have no doubt that we'll catch everything. We just need the time and the you know, the collaboration to do that.
I want to highlight a couple more comments that came out in the chat here. Several comments around the issue of disproportionality, whether it's related to Black, Indigenous, and people of color, or LGBTQA young people, or individuals in general. So that's something to note too. I think the questions that were framed as, is there going to be a subcommittee on these issues specifically, or are they woven into the subcommittees that we have listed here? So that's something to consider. And then a comment responding to the dialogue around that, around understanding, around what Representative Orwell was talking about with respect to call centers. And what's going to happen in July 2022 if we don't have the mobile crisis teams and stabilization facilities and peer support services in place? Senator Dingra.
Thank you. I just wanted to say that on the subcommittee, there are very few statutory requirements, but one of them, a few of them certainly are, that each subcommittee has to have an urban and rural voice on them, and that every subcommittee has to have at least one individual that's going to be focused on youth behavioral health. So really making sure that all of the work incorporates at least geographical challenges, and making sure that the youth voice and is there, or not even just a voice. If the youth want to participate, that's great, but also making sure we always keep that in mind as well.
That's a great point, and actually very much relates to a comment we just saw in the chat, which is woven through these subcommittees would be a preference of at least one of our guests today, because, and she put this beautifully, separating perpetuates separate. So other questions or comments from our steering committee members before we move on? Betsy, thank you for all your time in the hot seat today. You did a great job fielding all of our questions.
I just
and
want
comments.
to tell everyone that I have to just share a moment since I have a movie. I texted Nicola a minute ago and I said, hot seat.
I didn't even know that. Great minds, right? All right.
Hot seat today.
Wonderful. Okay, well, thank you, everyone. We actually are a little ahead of schedule now, so we'll be moving shortly into our public comment period, but I do want to pause and do some action items and next steps. So, and Nicola, jump in here, please, if I missed anything, or Liz. So the action items that I understand from today are, first of all, the project team and steering committee members are going to continue to pursue this issue of compensation for our folks with lived experience, look for creative ways to do this, and look at opportunities on the legislative side. With respect to our upcoming CRIS committee meeting next week, I am going to be volunteering our steering committee members what your role will be in our meeting next week with respect to welcoming, offering the land acknowledgement, and introducing and thanking our two folks who are offering their lived experience, their personal stories in our meeting. We will be sending out the agenda and meeting materials. I think Nicholas said tomorrow morning is when it's going to go out. So those will be going out for our CRIS committee members and posted to the website. And there'll be the link for folks to register. And we will also be connecting with HCA about getting the missing meeting up on the website so that that's there for everyone. Nicola, did I miss any action items?
I think you got it, Jamie.
Okay, great. Well, let's move then into public comment. As I mentioned, we have actually 13 folks on our list today. There was one person who withdrew. I'm going to pause. This typically goes out with the email to folks assigned to make public comment, but I think it's just probably worth reminding everyone about our rules for making public comment. So I'm sharing my screen. Can all of you see rules for making public comment on your screen? Good. Okay. So each speaker is going to be allocated 2 minutes. Because we have 13 people and we're a little ahead of schedule, I will keep it at the full 2 minutes today. As you know, or some of you know, when we have a longer list of people commenting and just 20 minutes, I sometimes bring that timing down to 90 seconds so we can get as many comments from people as possible. I am going to be strictly enforcing that. I will put my trusty timer on the screen. And so when you hit your 2 minute time, please wrap up your comments. I will ask you to wrap them up if you are continuing to talk after the 2 minutes. Speakers may not share or relinquish any of their remaining time to another speaker. Their time is theirs, but then I will move on to the next person on the list after they are done. Speakers are only allowed to speak one time during the public comment period, so please don't sign up again if you've already done it. Typically we say a person may speak only if they've signed up to speak, but today, because if we have a little time at the end of the meeting, I'll offer an opportunity for other guests to make a public comment if they'd like to today, if there's time remaining. Let's see, speakers shall be civil and courteous in their language and presentations. Of course, insults, profanity, use of vulgar language or gestures or other inappropriate behavior is not allowed. Important reminder, we should not, and I apologize, I think I put the CRIS committee one up here, but this goes for steering committee members as well. Speakers should not expect our steering committee members to respond to public comments. They're here to listen and hear you, but there will be no response today. And I will be, of course, enforcing all of these rules. I also want to make a really important reminder to everyone, which is sharing a public comment today on the screen is one of multiple ways for you to provide your feedback. So if you don't get called on today, or you don't feel comfortable speaking in front of an audience, and some of us do not, there are other ways to provide your feedback on this process and to provide a formal comment. And we do compile those comments and send them to our CRIS committee and steering committee members. So if you do not make a public comment on the screen today, please do feel free to go to the HCA website. There's an email address there and you can send your comment there. And as I said, we compile the comments and share them with the CRIS committee members. So don't feel obligated to come on a screen today. And finally, for those of you who are making comments today, if you have written versions of your comments, please email them to HCA. It really does help us make sure we capture everything that you said. And some of our CRIS committee members are probably more visual. And so seeing the comment written can be helpful to them in addition to hearing it. All right. So Nicola, would you mind just putting up on the screen again the list of folks who are making comment today? And the way this is going to work is I'm going to call your names 3 at a time. So the first name I call is the person who's up next, and then I'll call the subsequent names. I'm going to do my very best to pronounce your names correctly, but please forgive me if I mispronounce your name. As I said, I'm going to be sharing the screen in a moment with the timer. So please be mindful of your time as you're providing your comment. And again, please start by saying your full name and send us your written comments via the email address if you have an opportunity to do that. All right, you can stop the share, Nicola. I'm going to put up the timer. Just make sure that timer on the screen. I do. All right. Wonderful. So first up is Roxanne Slayton, followed by Lindsay Sprinkle, followed by Laura Van Tosh. And when you come up, if you have it available to you, please put your camera on. If you feel more comfortable or you don't have the bandwidth today, it's okay to leave your camera off. So do we have Roxanne? I know she was here earlier.
Yes, I'm here.
Hi, Roxanne. Okay, I'll start the timer. You go ahead.
So I live with lived experience with human trafficking, domestic violence, traumatic brain injury, and I've attempted suicide before, and I don't want others to do so. If I could help in that way, that would be great. And also, I actually go by my nickname, which is Adia. I like my birth name better than
Looks like we might have lost.
this stuff will be good for the for other people, so they don't have to live through what I had done, or I can help them. I really think it's important that people have a voice and that people encourage each other and stuff. And I don't really know what else to say. I just wanted to say that I'm really happy that you're doing this work, and I hope I can be of assistance to you. So.
Thank you, Roxanne. And for just a moment during your comment, your screen froze up. So if you do have a written comment and you could send it in, that would be wonderful.
Okay, I'll work on that tomorrow.
Okay.
Do I just send it to the HCA website?
Yes, please. There's an email address on the HCA website, and we really appreciate that.
Okay, thank you.
Thank you, Roxanne. All right, next up is Lindsay Sprinkle, followed by Laura Van Tosh, followed by Lisa Stradinger. So Lindsay, when you're ready, if you can turn on your camera, we'll go. Nicola, do we see Lindsay on our call today? Nope. Lindsay, are you there? Nicola, do you see Lindsay on the call?
I just did a search and I do not see her.
Okay, I'm going to make a note. We'll circle back to Lindsay. Let's go to, I know Laura Van Tosh is on the call, followed by Lisa Stradinger, followed by Stephen Morrison. So Laura, when you're ready, go for it.
Good afternoon. First of all, I just want to thank with all my heart Representative Orwell and all of the work that she has done, also later with Senator Dingra, on having a bill, period. We not only need it, or I guess we have to have 988, but to do it with such care and diligence and sensitiveness is certainly impressive in terms of how, as far as I'm concerned. And I know very many other people as well. So I wish you all the best of luck in your efforts. The only request I have at this point, I want to go back to when I worked at Western State Hospital as the Director of Consumer Affairs. And I attended all of the meetings involving deaths at the hospital. And we had what was called a root cause analysis. And there was when there was a suicide, and the bottom line was that this patient basically didn't have anybody to talk to. And that was one of the main reasons why he had committed suicide. And it was one of the most heartbreaking kind of quote investigations that I've been involved with in terms of patient issues and suicide at that institution. And so I really hope that we look at not only crisis entrance, but the exit, and how we can support people in their lives after they get through a crisis. My final quick point is that we have got to get this information down to the counties. They are ultimately the decision makers around all of these issues that are being brought up today. I want to call out lived experience and the role of counties and how crucial it is that if they don't consider patient perspectives important in terms of their policymaking, then how are we going to be able to expect them to adapt and shift their thinking and their actions in terms of crisis services and suicide prevention? Thank you very much.
Thank you, Laura. All right, next up is Lisa Stridinger, followed by Stephen Morrison, followed by Amy Pereira. Lisa, are you with us?
And Jamie, the next person I actually see present is Jennifer Stuber.
Okay.
But we might want to call and just make sure that others aren't here.
I'm going to call the other names. I'm just making a note so I can circle back to folks. Okay, so it sounds like we don't see Lisa Stridinger. Is Stephen Morrison with us? Raise your hand if I'm just missing seeing you. Okay, let's try Amy Pereira. Okay, how about Ron Harding? All right, and Michael Robertson. Okay, Donna Bottineau. Okay, I'm going to run through this list one more time after we hear from folks who we are seeing. So let's go with Jennifer Stuber. Jen, when you're ready, I'll turn on the timer.
Hi, I don't know if you can all see me and hear me, but thanks for the inclusiveness of this process and for allowing us to listen into this meeting. I'm Jen Stuber and I'm on the CRIS committee and a professor at the UW. Just wanted to make 3 short comments. The first one is no one's brought up the advisory vote that was on the ballot. That was, I know it's largely ceremonial, but the fact that it was appealed, the vote for the tax, was quite discouraging to me personally as someone who had advocated for this legislation and have been working hard on it, for almost the last year. And I feel like we truly need a communications effort that is not only going to educate people with lived experience and those who will benefit from these services, but also the voters. And I feel like this work is so worthy and important. And we have robust resources between public employees and private resources. And I really hope that we can get a robust communication effort off the ground so that we don't have anything that looks like that experience we've just had at the ballot box. Second comment would be the reference to a learning community. There's a very robust learning community Crisis Now puts on every Wednesday at 9 a.m. And I don't know how many people on the steering committee are part of that, but it has truly been transformative for many people, many states across the country. And I would really hope that we could kind of replicate something like that with our CRIS and with our HCA website. Let's post the best practices. Let's post those presentations. Let's encourage people to go. Let's have more conversation, more meetings as a CRIS. I really do think we need it. I'm discouraged that we're having a report. I realize it's a living document, but we're having a report on the state of our crisis system in our state without really any real conversation about that beyond thematic. So just something to put out there, like we want to be useful. we want to have a robust learning community, and the model for it is out there. So thank you.
Thank you, Jen. All right, next up is Kristen Wells, and I do see Kristen. Kristen, when you're ready, I'll start the timer.
Hello, my name is Kristen Wells. I'm a social worker working in community mental health. I actually do after-hours crisis. I kind of want to focus on technology and mid-level services. During COVID, I've been working from home, which has meant that I'm assessing people by phone while they're in the emergency room. And that's been really challenging. I'd really like to see more resources, especially for crisis services, to have video available. It's really hard to assess someone by phone. If they don't want to talk to me, they can just hang up. A video would at least let me have a chance to see, how they're moving, if they're doing things that I'm not hearing on the phone, so I could write a summary of how the person presents visually. And that's been missing. I've only been able to assess people by video a few times. And then mid-level services is something that I've noticed. I've been in mental health for 4 years, and there's a really big gap between outpatient services and inpatient services, where a lot of my clients that aren't, they're not qualified for an ITA, but they still really need help, and outpatient isn't enough. I'd really love to see more services to fill that gap. One of the things I was really excited about reading in the bill was things like peer respite centers that people could go to. I know that came up a few years ago originally, and I hadn't heard anything about it for a long time. So I'm really glad that that's been included. That's everything from me. Thank you.
Thank you, Kristen. All right, next up on the list is Nancy Shaw, followed by, and please forgive me, Shriram Raja Gopalan, but I don't see Nancy on the call. So Nancy, are you with us? Okay, then our last person today on our list is Shriram Raja Gopalan. When you're ready, I will start the timer.
Hi, I'm ready.
Okay.
So just 1 minute, there's an echo.
Mm-hmm.
Hi, my name is Sriram Rajagopalan. I'm actually calling to advocate on behalf of a community that at least I haven't seen represented so far in all the public materials I've seen. It's the homeless community. The homeless community is often in crisis, and I volunteered as a street outreach volunteer helping homeless youth for a number of years, and I noticed many of them in crisis at many points in time, and whatever resources we pointed them to, it did not work consistently for them. And so this is a community that does not trust the system. They have been constantly let down by the system in many, many ways. And even when they do reach out, often it's the cops coming out to disrupt them or arrest them. And so they have learned to kind of feel like the crisis system will not work for them. And I think when I look at the bill and I look at the representation on the CRIS committee, I did not see any homeless services organizations. I did not see any mention in the bill of the homeless population as a group that needs some attention. So that's kind of why I wanted to put this on record as a segment of the population we need to take a close look at as part of the crisis system redesign. I'm sure it's not the intent to not care about them at all, and maybe they are being taken care of in other ways, but I want to kind of look at them as a core constituent, somebody who needs to be helped. We need to build trust with this community. We need to make it easier for them and empower them to access the crisis resources, and then make sure that the response delivery system works for them, because they are not in a stable place. So how do we reach out to them is also another critical aspect. So that's really what I wanted to advocate for this meeting. And thank you for all of you for doing this really important work.
Thank you. Okay, so we have a little bit of time left. There's probably time to take a few more comments if there are any members of our public today who would like to make a comment. So if you could use your raise your hand function if you'd like to make a comment, I will look for you. right, I'm not seeing any additional hands up to make a comment. So I'll wrap up. You'll have another couple of seconds here to raise your hand if you change your mind. But again, thank you to everyone who did make comments today. I'll stop the share so I can see all of you. Excuse me. Thank you to everyone who did make a comment today. Please do, if you can, send your written comments via the email address on the HCA website to us, and we will make sure those get out to the steering committee and other CRIS members. And of course, as always, please do send your feedback and comments. Even if you did not make a public comment today, we'd love to hear from you. As you know, we are doing our best to be flexible and responsive within the timelines that we are facing to be mindful of your feedback and respond to it. I want to thank all of our steering committee members, most especially our newest, Vipasha, for being here today and your wonderful contributions. Look forward to seeing you in a week at our next CRIS committee meeting. Betsy, do you want to say any final words before we say goodbye?
I just want to say thank you to everyone who joined the meeting and for all your comments. This is a really dynamic process. I feel grateful and honored to be a part of it, and want to just reinforce, I hope the message that I gave, which is, you know, we're working together and we always want to hear from you, and your comments are appreciated, and we will figure out how to incorporate feedback all along the way. So again, just thank you for coming today, and we look forward to the hard work ahead.
Yes, I echo that. Thank you, everyone who's participated today and shared your comments in the chat. As I mentioned earlier, we are recording it, and we'll be reviewing that and making sure it becomes part of the record. So thank you again. Thank you, steering committee members. Be well. We will stay dry. We will see you in a week. And thank you. One final thank you to our ASL interpreters who were heroes today. Thank you very much. Be well, everyone.
Thank you all.
Thank you.